Welcome to one of my favorite topics, pregnancy and birth. Your chapter starts out talking about fertility, the statistics and trends. In 2015, which would be probably the most current statistics, there were close to 4 million registered births in the United States, which was slightly lower than in the prior year. Birth rates among women under 30 had dropped, though they had increased in women ages 30 to 44. So that shows that women are waiting until they're older to have their families. Birth rates to teens had decreased by 46% since 2007. So this tells me that we're doing a better job of educating teens on how to keep from having unplanned pregnancies. And then there was an increase by 15% of women ages 40 to 44, which presents its own set of problems. Conception. Basically, our biological design does all it can to encourage pregnancy. A woman's desire actually increases during her ovulating time until just before menstruation. Ovulation typically occurs 14 days before a woman starts her period. Sperm are viable for up to 72 hours and an egg is viable from 24 to 48 hours. So depending on when one has intercourse during that time, that the egg is released, there is about a 7-day period surrounding this ovulation where a woman can get pregnant. In addition, during ovulation, the cervical mucus is slippery like raw egg white, making it easy for sperm to swim to get to the egg. And then after ejaculation, the semen thickens so that it helps it stay in the vagina, and then it liquefies about 20 minutes later so that it can more easily get to the egg. There are so many things that go on to help conception be even more likely. Your chapter then goes on to talk about the continuation of this process and the early signs of pregnancy. It also talks about the difference between fraternal and identical twins. Fraternal twins are where you have 2 egg and 2 sperm, so those children are no more alike than siblings. So they can be both the same gender or opposite gender. Identical twins is when you have 1 egg and 1 sperm, and it's how the egg divides. So those twins are called monozygotic or identical. They usually look very much alike and are always the same sex. Your text in this chapter also addresses infertility, which affects between 15 to 20% of couples worldwide. And that is defined as the inability to conceive after trying for 1 year. If you can't get pregnant after 6 months and go to the doctor, they're going to say keep trying for a year. Often women who are older than 35 have often been ones who have problems with infertility. So the older a woman is as she wants to get pregnant, the more likelihood of having infertility issues. There are so many ways, though, today, if somebody can't get pregnant naturally, that they can have medical science help them. There's assisted reproductive technologies, so that's great for single women if they want to have children, or even gays and lesbians if they want to have children. There are fertility drugs, there's surgeries. There's artificial insemination where they take the egg and put it into the woman either through in vitro or directly into the body. We have GIFT and ZIFT. GIFT is gamete intrafallopian tube transfer. That's similar to in vitro where they put it in a petri dish where the ova and sperm are gathered in an artificial environment, but the difference is that the ova and sperm are placed directly into the fallopian tube prior to fertilization. ZIFT is where the ova, which stands for zygote intrafallopian tube transfer, the ova and sperm are fertilized outside the body, and then directly following fertilization, the embryo is placed into the fallopian tube where it travels to the uterus and implants. That way they can know if it was fertilized or not. Then there is intracytoplasmic sperm injection, ICSI. that was developed for couples experiencing sperm problems or over-resistant to fertilization. And they directly inject a single sperm into an ova via a microscope. And then if all of those processes fail, they can do surrogate parenting, where somebody chooses to have a baby for the couple. Of course, there's some ethical issues. As you probably are aware, the first woman that agreed to have a baby for a couple, she carried the baby, gave birth, and then after she gave birth, she said she could not give it up. And the courts ruled that it was her body that gave birth to the baby. It was her ovaries. It was the young couple's sperm, the male sperm, but it was her ovary, and she carried the baby to term, gave birth, and the courts ruled that she could keep it. A healthy pregnancy is divided into 3 trimesters. A full-term pregnancy is actually 40 weeks. And your book does a nice job going through each one of the trimesters and what happens. It talks about health care during pregnancy, good exercise. Basically, a woman should be able to do most things that she did before she became pregnant. Until she is further along, then she may not be able to do as much. But she wants to have good nutrition. And most women, when they're pregnant, they delve into learning everything they can to have a healthy pregnancy. So they learn to eat very healthfully. Drugs and alcohol, of course, want to not to participate in those when you're pregnant. Alcohol, if you drink it when you're pregnant, you run the risk of having a fetal alcohol syndrome baby, which has irreversible physical and mental disabilities. Earlier we mentioned more women are waiting till they're older before having their first child. When a woman is older, it may take her longer to get pregnant because she's not as fertile as she was when she was younger. They may also run the risk of having a miscarriage, sometimes called a spontaneous abortion. I prefer to call it a miscarriage. Sex during pregnancy, you should be able to continue to be sexually active up until the time your water breaks or you lose your mucus plug. When those 2 things happen, then infection could set in, so you don't want to have sex then. Basically, at that point, you want to go to the doctor to have the baby. Some problems during pregnancy. An ectopic pregnancy is one that grows outside the uterus. Often it gets stuck in the fallopian tubes. This can be caused from scar tissue. And a fallopian tube does not stretch like the uterus does, so if the egg starts to grow, as it does through the blastocyst process, then it would cause the tube to break, and this could cause a woman to die if she didn't catch it. So if you know you're pregnant, or if you don't, and you have the likelihood of being pregnant, and you have excruciating pain in the abdomen, you need to go to the doctor so that they can help you figure out if that is the situation or not. More information is covered in your book on miscarriages. Most miscarriages, there is some type of chromosomal abnormality, and usually they happen within the first 3 months. After having 2 miscarriages myself, I know they are not easy to go through. The loss of a baby you're excited to have. For most miscarriages, you just don't know what has caused it to happen. Someone once explained to me that it was God's way of taking care of something that wasn't right. So that would be referring to a chromosomal abnormality. I do know that due to the timing of my miscarriages, if I wouldn't have had those miscarriages, then I wouldn't have the children I do, and I don't know what I would do without my children. So good can come from all things. Your book also talks about birth defects, how you can learn about if you are going to have a child with a birth defect ahead of time through chorionic villa sampling, where they can go in and take a section of the placenta, or they can do a process from gathering amniotic fluid through amniocentesis and do tests to help determine your risk of having a baby with a birth defect. It also talks about Rh incompatibility, toxemia, and then the last part of the chapter covers childbirth. So enjoy this chapter and learning all you can about what it takes to have a healthy pregnancy and baby.